Are there any questions? I was a bit uncertain about whether I should show that.
I did a test with a residential story where there's words, but they're really sort of aloysius, really strange words.
Right. Okay.
Is that the same thing?
Not quite. These are all real words. So words like fish or dog.
Hello.
The idea
There
is
you go.
to make it more like a real life situation.
Yeah.
Because what I'm most interested in finding is where people with scar are having, daily numbers when they're older.
I think it's just
Any other questions?
Do you have to be tested, or can you have scar 1, 2, or 6 maybe, or any scar maybe?
I think we can see any scar. It would certainly be better if you know, for us to know that, so that we can know which group to put people in and know better how to interpret the results. But I think any scar patients will be fine.
Thank you.
Are there any other?
I was going to ask, so if something is found wrong with, say, a scar 2, which I haven't been tested, but I think I've got scar 2. So it is a matter of introducing a hearing aid to improve that?
Yeah.
If you found a problem.
Hearing aids are usually not very helpful in this sort of hearing problem, because hearing aids just make sounds louder.
Right.
So what seems to be the issue is that sounds are getting distorted. So with a hearing aid, you just have a loud, distorted signal rather than normal.
So would it be some other device to clarify?
Yeah, so this device, as I mentioned with the Friedrichs group, where we try and cut out on background noise, it doesn't necessarily amplify the sound, but it just reduces the background noise problems. But yeah, hearing aids not usually helpful.
During the research, will you be requiring control patients as well
Yes.
from the same family?
Well, not necessarily from the same family, but we'd
Just-
certainly be interested in testing
Okay.
people who are age matched and gender matched.
Okay.
Also.
Thank you.
Would this possibly explain with some of the scars people I've met who tend to yelp, or is that more they're having trouble getting the words out?
It's hard to say. With some forms of hearing loss, people do speak a lot louder just because their voice sounds softer to them or sounds unclear. So it's possible. But there may be some other things going on as well. If you're having production issues, if you're struggling to say things properly, you might also go louder.
And just the problem creates then vocal problems, like verbalizing problems. So if you're not hearing the sound, you must be reproducing that sound incorrectly.
Certainly, yeah. And it's not such an issue for adults, but certainly if we see this in children, if they can't learn their speech hearing a nice clear signal, then they don't learn to talk very clearly. But yes, being able to hear yourself clearly is certainly part of speaking.
Gary, I saw on your scales there something I didn't understand, because you started off with a high, which I thought was a high decibel, going to a 0 decibel, and the people that had 0 decibel interference, as I thought, got less. Can you explain that?
What these levels here mean is the relative loudness of the speech and the background noise.
Aha.
So plus 10 dB is where the speech is 10 decibels higher than the noise.
Aha.
0 is where the speech and the noise are the same level.
Aha.
So that's much
Good.
harder.
Thank you.
But as I mentioned, in a normal classroom or in this sort of environment where there's a fan, it's probably somewhere between plus 5 and 0. So these are everyday listening conditions that people are struggling with.
Thank you.
What do you want to be a subject?
Well, good question. I'm glad you asked. I have some sheets which I could pass around.
I was going to ask that question.
So I have them divided into the different scar groups. There's a page for group 1 and 2 and so on. But if you don't know, and if you're interested in participating, or if you don't have 1, 2 or 6, there's an others group at the back here. So if you could put your name and perhaps your contact details, so maybe an email address or a telephone or something, then I can get in touch with you.
You or one of the students?
Yes, probably me, because I'll be looking to try and get some feel for what the numbers are like before the students get involved. But certainly, you know, if you do put your name here, it's, you know, I'm not asking you to sign up for anything. You can change your mind, or but what it means is that you're interested in perhaps having a chat to me about you know, what's involved and whether you do in fact want to participate.
Do you have to be tested to actually participate in this?
No, but again, it's better if, you know, in terms of interpreting the results, if we know which sky group it is.
Right. But if I can just tell you, I think it's 2.
All right. Well, I think that's all right then.
But wouldn't it be better for your results if you've got diagnosed people and undiagnosed but query, which
Yes.
okay.
So, you know, at this stage I'm not sure what the numbers are going to be like, so we'll sort of make it up as we go along a bit.
You get a rush.
Yeah. I mean, my hope is that for each of these 3 sky groups I can get 10 subjects who fit within each category, but if it's only 5 within each, well, that's still fine too. We'll just see how it goes. It depends a bit on your group and how generous you've prepared for that.
Yes, so could you put something we'll put on the website? We'll ask the agreement.
Yeah.
We should advertise on the website.
I'll write a
We have
paragraph
further
or two.
other
Maybe we
studies.
could have this presentation as well.
Lovely.
If you thought that would be helpful.
Please.
Is it just a degenerative condition that you never improved? It's got really...
Well, I don't know enough about it at this stage to be able to answer that. Certainly in the Friedrich's group, it does get worse as the overall disease progresses. Yeah. But as I mentioned, I'm interested in things we can do about it. So if someone has a communication problem, then there are steps that we can take, so strategies we can put in place to try and help them.
Thank you. Testing group. I'm from Mildura.
Right.
I can't see you coming up there.
Well, if you could put your name on the list.
Can I just
Sorry to meet you.
get here?
Yeah. In the past, I've sort of set a limit of 2 hours drive from
Yeah, it's a bit
not
further.
quite. But there may be a student who lives in Mildura, and I have students who come from all around the state and interstate as well. And most of the testing they do is during their mid-year break. So they're in a position to travel around here, perhaps. So, you know, if it was not just you, perhaps if there were a number of people in Mildura who had it, then it might be worth taking a trip.
Is there a chance you come to Melbourne?
Yeah. Because I get just like getting apart from the travel.
Yeah.
So
or we could try and fit in when you're coming down.
Good idea.
So there's sort of a 6-month window there when we grab people. So, you know, it's all designed to make it as convenient as possible for you.
Okay. So would you like to pass that around to people or
I know I live on in the hill sound.
So thank you, Dr. Reed. Can we show our appreciation?